The experience of trauma affects the way that you regulate your nervous system. It affects the way that you think about everything in your life. And oftentimes you're aware of that, sometimes you're not. And it's really important that your provider approaches your experience with the knowledge that you may have trauma in your background. It's really important that your provider can help you examine your experience through a trauma-informed lens, and they can assist you in putting your experiences in context. Trauma affects the way that you view everything: yourself, other people, your relationships, the world. And oftentimes you're aware of this, sometimes you're not. A non-trauma informed provider may ask you to explain behaviors in a way that can be re-traumatizing. It might be triggering if they ask you in session 1 to divulge details of something that was really stressful or traumatic for you. And they may not intend this to be troublesome, but it can be very difficult. A trauma-informed provider understands the pacing and the importance of working within what's called a window of tolerance, and how it's important to be able to help a trauma survivor work from a place of felt safety, what we call a felt sense of safety. And so trauma-informed care helps a client establish a strong sense of safety right from the beginning of treatment. This is one of the hallmarks of trauma-informed care. And being able to establish coping skills, a strong alliance, that's the hallmark of most therapy, hopefully, but with trauma-informed care, there's this strong attunement to being able to work towards this as it relates to trauma processing. When it comes to how trauma-informed care can help trauma survivors, what we know is that there is a large canon of evidence-based treatment for trauma out there. And so as a trauma-informed provider, you're holding that at the same time as you are what a general provider would in terms of alliance and pacing, and you're balancing all of this.